Knock knock. Hello, my name is Ashley. I'll be your student nurse today. Can I have you verify your name and date of birth, please? Okay, thank you, Mr. Bob. I have checked your orders and it says here that we will be, the doctor ordered some ceftriaxone for you. Before we get started, do you have any allergies? No? Okay. And this is a IV piggyback medication. So now I'll be giving you some privacy and I'm gonna wash my hands for 20 seconds. So let me go grab this stuff really quick and I will be right with you. So now I'm going to the bedroom and I'm checking my MAR and it says here that I will be giving ceftriaxone at 5 p.m. for Billy Bob, 1 gram IV piggyback daily. And I see here it is correct. And I am also checking Nursing Central, and it says here that I am able to dilute it with the 5% dextrose. It is 100 milliliters, and the rate is over 30 minutes. So we have that correct. And I also grabbed a secondary set. Let's see. So there's my first check. And now I'm going to be preparing and doing my second check. So here I have ceftriaxone, 5 p.m. for Billy Bob, 1 gram IV piggyback daily. And I will be diluting it with the 5% dextrose, 100 milliliters, with my secondary set. And it does say here that the drop rate is 20 drops per milliliter. So when I do my calculations, that gives me 67 drops per minute. So let's prepare it. So the first thing I would do is take this, I would wash my hands, remove this blue cap, and I'm going to grab a alcohol wipe, make sure that's clean, and I'm going to grab my dextrose. Going to remove this foil, keeping it sterile. Make sure it's in there. And I'm going to break the neck. So now I'm going to get some solution in there. Shake it, make sure it's all diluted. Okay, so now I'm going to turn it around, get some negative pressure. A little bit more in there. Okay. So now that it's done, there's a little bit in there. Okay. So that is prepared. And while I am still in here in the bedroom, I'm going to label my ceftriaxone with the label. And this is my label. It's going to have all my patient's information, such as their name, date of birth, their room number, the medication, which is ceftriaxone for 5 p.m. for Billy Bob, 1 gram IV piggyback. So that is on there. And now I'm going to take this back into my patient's room. Okay, so hello, Mr. Billy Bob. I'm back with your IV medication. So I'm going to be telling you a little bit about it. So you are receiving ceftriaxone and checking Nursing Central, and let's see, it is a anti-infective. Some adverse effects that you may experience are diarrhea, maybe a rash, pain at your IV site. Something more serious that could occur could be C. diff, renal failure, seizures, or anaphylaxis. So So I'm going to give you your education, patient education for today. If you do notice any blood, any abnormal stool, such as diarrhea, please make sure to let us know. Or if you do notice a rash, or if you are experiencing pain, let us know so that we can call the healthcare provider to see if we can just see what we can do for you. Maybe change it up if needed. And you did mention that you have no allergies. I'm also checking Nurse Essential. It is within the safe dose range of 1 to 2 grams. Okay, so now I'm going to scan my medication. And I'm going to scan your bracelet. Alright. So now I am ready to administer. I'm going to open up my bag here. So the first thing I'm going to do is I'm going to clamp it. And I'm going to take this off, keeping it sterile. I want to take off this cap. I'm going to spike it. Okay. So now I'm going to fill it up about 2/3 full. Okay. So now I'm going to hang it up. I'm going to hang it higher than the primary IV. And I'm going to remove this cap. And I'm going to prime it. I'm going to release the clamp very slowly. Okay, so I have primed my secondary medication. So now I'm going to grab an alcohol swab, and I'm going to, on my primary tubing, it is clamped. So it is clamped. I'm going to alcohol swab the port here, the white port. And I'm going to connect it. Okay, and then I would figure out, so I did mention the drop rate is 67 drops per minute. So what I would do is I would slowly release the clamp, and I would watch my watch for a full minute to adjust the drop rate, which would be 67 drops per minute. And so when I got that ready, I would unclamp both of them. And so now the patient is receiving the medication, ceftriaxone. So I would clean all of this up. And do you have any questions for me? No? Okay. So now, after I have finished my 3 checks and the patient is receiving the medication, I'm going to do my final step, which is documentation. So I'm just going to go into the EHR, the MAR, and I'm going to document everything that I have done today. I gave ceftriaxone for Billy Bob at 5 p.m. 1 gram IV piggyback daily. Let's see. he had that the 100 milliliter dextrose 5%, infusion rate over 30, and I make sure the patient is comfortable, lower their bed, have their collar in place.